minutes and 20 seconds away from the storytelling. Bring the noise down here. Bring the music down, I should say. Visual storytelling for health with our friend and first fellow of photography, Chris deBode, and many scholars of the Geneva Learning Foundation. Tafurola Mutange is one of them. Tafurola, warm welcome to you. Are you able to say hello and introduce yourself? And then we'll come back to you to ask you the questions that will be the subject of the workshop. Oh, I see Tafurola Mutange. Your microphone is moving, but we're not hearing anything from you. Can you please check your audio inputs and outputs? All right. And this will happen to many of you who have a lot to say, have very interesting things to say, and you won't be able to say them orally. So we encourage you to really use the chat, and we'll be sharing. As you can see, we can share the chat here, and this is actually in French. This is a bilingual workshop. We have interpreters in the room whom we thank for their contribution. And here you see, for example, Patrice Kazadi, who says this workshop is important for us because it's going to help us improve our competencies to document what we implement in terms of activities, in particular in the field of vaccination. Was that you, Charlotte?
No, Red, it was Tafurola.
Okay, we missed her again. Let's try again in a minute. All right. We're now counting down the final 30 seconds, and we already want to say hello to Adeyemo Sunday Charles, who says, who's calling in via YouTube from Niamey in Niger. Here we go. So if you are watching on social media, don't hesitate. Let us know that you're there. Share your comments. You can also ask questions and respond to the questions that we ask. You don't need to just say hello, which is what most people do. Here we go. All right, a warm welcome to you from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation, and I'm here, of course, with Charlotte Mbou, who is calling in from Ebolova, Cameroon. How are you this morning, Charlotte?
I'm doing great, Reda, and it's a real pleasure to be a part of this visual storytelling workshop with Chris deBode.
All right, wonderful. And what would you like to say to Alice Niaboke? She just said hi on YouTube. What would you like to say? What would you like to know about Alice beyond the greeting?
Hi, Alice. I would really want to know where you are connecting from, who you are, what you do, and why you are interested in joining this workshop today.
All right, wonderful. And now we have already messages with us in the Zoom studio. Is an exceptional group of people who have shown already in the past a commitment to visual storytelling. You can see a message from Patrick Majadinga, who says, good morning, everyone. Happy to be here. Tell us why you're happy, Charlotte. That's what we want to know. Zachary Yaoutairou Insa, a message in French connecting from Niger, and then from Brazzaville, from the Congo. Patrick Majadinga is explaining where he's from. And then, of course, we have, again, on YouTube, where most people seem to be, but we're also live streaming to LinkedIn, Facebook, Twitter, X. Becky Tagbo from Nigeria, please let us know why you've come to this visual storytelling workshop. Now, for those of you who are going to have connectivity problems, I'd like to reassure you, everything from this workshop will be available, will be shared with you afterwards. Immediately afterwards, you'll be able to find it on our YouTube channel, and you can also subscribe to the podcast to receive the content as low audio, low bandwidth. Now, this is an interpreted event, so for those of you in the Zoom studio, we're going to ask you to help the language interpreters use a headset, make sure your connection, do the best you can for your connectivity and your microphone and headphones, and try to speak at a slower pace. That can be very helpful. Voici les mêmes instructions pour les francophones. Here are the same instructions for the francophones. Now, first of all, the amazing thing that we'd like to start with today is just the sheer number of people who have signed up for this workshop. So the first thing I'd like to share is just to thank you. And Again, we'd like to ask Chris, 553 health professionals who are busy doing life-saving work in countries of Africa, Asia, and Latin America have signed up for today's workshop. What would you like to say to them?
Wow, a warm welcome. It's mind-blowing for me that you're all here in this at this event, and we'll make this event rock. And I'll try to teach you something and have nice discussions about photography. So I'm ready.
All right, thank you, Chris. Okay, and again, we want to honor the health professionals from 55 countries. You can see here. Now, a few days ago, I had sent these data to Chris, and there are 99 people from the DRC. And so he said, where's the 100th participant? So we did get that 100th participant. 55 countries represented. We'd like to start by turning to Brigitte Megang and to ask her. Brigitte participated in 2022 and 2023, shared a photo of her immunization work.
Merci.
Oui. On vous écoute, Brigitte.
Bonjour à tous. Moi, c'est Brigitte Megang. Je suis professionnelle.
Megang. I'm a professional health worker, and I work in Yaoundé in Cameroon. Nice to be here. I'm attending this event because I believe that with a picture you can say 1,000 words, and with a beautiful picture you can learn a lot. You can understand a lot, and you can understand really the story just by looking at a picture usually. Thank you.
Merci Brigitte. Et donc la prochaine question pour vous, Brigitte.
Thank you so much, Brigitte.
Quelle photo allez-vous partager cette année et en quoi sera-t-elle différente de celle de la dernière fois?
So what's the picture you're going to share this year, and why is that going to be different from what you did last time? This year, I want to share a picture on the cold supply chain and on monitoring and control.
Okay. Et pourquoi partager cette photo?
Why do you want to share a picture on this topic? I want to share because I think it's a significant topic for immunization. And I think we can show like the different methods just with a picture, and show also how it can concretely work with a cold supply chain.
Merci Brigitte. Thank you, Brigitte.
Thank you so much, Brigitte.
We're now going to go to Tafu Rother Mutange. Tafu Rother Mutange, we'd love to hear from you as well. I hope your audio and connectivity are going to hold, because I know that you have some very interesting things to say. What have you learned from sharing photos and seeing photos from your colleagues? But first, tell us who you are and what you do.
Hello.
Yes, Tafu Rother. Yes, can you speak up, speak really loud, and please introduce yourself.
Yes, my name is Tafroda Mtange. I come from Kenya. I work as a community health worker with the facility of Kangemi. I've learned that sharing photos will make us learn much from the community health workers from other countries. And photos also shows exactly what one is doing in the community at the ground level. So this will help me much to communicate, to implement in my community, and it will make me know what to do, what time and when.
That's a beautiful response, Tafu Rother. Can I ask you, what are you doing right now? Like, what would you be doing usually if you weren't connecting with us and with Chris deBode? I can hear kids in the background. Are you at work or at home? We just want to get a sense of beyond the words, what you're thinking and feeling right now.
Since I started networking with the Geneva Learning Foundation, I've learned a lot, and it has made me know what to do, who to involve when there is crucial or emergency in my community. And that the strategy form or the strategy you gave me has been a very good guideline to me to learn what to do, where and when with my colleagues.
Thank you, Tafuro Mutange. I know that you've been a prolific contributor to the special event From Community to Planet, focused on where we launched a call last July 2023, to our global network platform and community, and said, can you share your observations of what's changing with climate and what's changing with health? And you've shared many responses. What would you like to say about when you think about if you were to take a picture of how climate change is affecting the health of the community that you serve, what would you show? What would you like people to see that may not be currently visible, except for those who are experiencing these impacts?
By the photos, what I want to show to people is the floods, because I remember having told you that in my community where I work, there was too much rain, and during that much rain, the floods were too much, and water entered into a house where there was a 12-year-old girl sleeping. The water carried the girl out, and up to date, as I'm talking, she has never been seen. So climate change goes together with health, because after the rains, the children, pregnant mothers, and even elder people get sick, and you might see there's no enough drugs in the facility, so we might even go along losing some lives.
Thank you, Tafuro. Chris, you've just heard a few of the introductions and a few of the thoughts that these health professionals who have taken time out of their busy schedule to be here with you. What did you hear in these first two ideas and thoughts shared by Brigitte and Tafuro?
Yeah, what I hear is that both contributors are really aware of the power of visual storytelling and the power of the image to transmit a certain idea and a situation, and maybe also urgency, which can be captured in an image and be shared with the community. And it's a very direct way to communicate with the people, and especially related to climate change and health. I think it's a very, very important topic, and I'm really, really anxious to see more of these photos from also the people joining this event today, because if we get all these pictures together, we document what's going on in the world, and by photography, it's accessible, it's easy. I'm going to tell you a lot more about it later on, but I'm really excited about the commitment of people. Yeah, that really is very good to hear.
Thank you very much indeed, Chris. All right, we have a third speaker and contributor. And again, I'll explain to you who's in the room, who's in the Zoom studio with us, and why. And that is Malamine. So Malamine Sané, j'aimerais vous demander d'activer votre micro.
Bonjour.
Malamine, oui. Voilà, alors bonjour à vous Malamine Sané.
Hello everyone. Hi Malamine Sané. How are you?
Alors j'aimerais vous demander ce que vous avez
I have a
appris
question for you. So what did you learn?
En partageant votre photo et en voyant
By
celle de vos
sharing
collègues.
here your photo and looking at your colleagues' photos. I believe that it's very accessible. You know, photos are accessible to all. And even if just with one photo, you can say a lot. And when we talk about immunization for children, I think it's really about education. You can use visual storytelling for education. As an epidemiologist and teacher, I believe that photos are essential in our stories.
Merci Malamine Sané.
Thank you so much, Malamine Sané.
Maintenant, quelle photo allez-vous partager cette année et en quoi sera-t-elle différente?
What photo will you share this year and why will it be different? I don't know yet. That's a good question. Last year, I shared many photos with my colleagues, and I worked with the WHO. So this year we haven't yet started in Senegal with our activities in the field, but I know I will have a lot to share because, as I said, photos can tell so much stories. So I'm kind of looking forward to start collecting photos. Thank you.
All right, wonderful. So first of all, let's give a round of applause for his first speakers, first voices we hear today. Of course, then we're going to deep dive with Chris deBode into the art of visual storytelling. Just want to acknowledge the messages. I showed them on screen, but I think they're worth making a pause to actually read them. Becky Tagbo from Nigeria, who says, I do a lot of pictures and video messaging on social media. So when I saw this invite, I immediately jumped for it. And she says she's looking forward. The other message I've already showed that stood out for me is Charmel Chouakam. I'm a health worker at the regional level. I think pictures are an important means of sharing difficulties encountered by community health workers and adjust strategies. Okay, so now let's go into let's say our first photo that we'd like to hear about. This is a photo. I'll pause here just to give you a few seconds to take in everything that is going on, and then I will tell you about it. And then, of course, we'll turn to Chris so he can tell us his thoughts, his reflections upon seeing this this photo. So now, let me tell you, let's go backwards. So this is a submission from Loretta Okpeme, who works in a district in a non-governmental organization in River State, Nigeria. Now, she says this photo was taken in January 2023, so over a year ago, during a free community health outreach. She says, I captured the photo of children that has been attended to by the doctors and pharmacists as they were about to walk out from the hall where the event was hosted. Now, I'm just checking, unfortunately, Loretta, probably due to connectivity, is not in the room with us. If you are on watching the live stream on YouTube, Facebook, LinkedIn, or Twitter X, let us know so we can acknowledge you. The photo was not very sharp, she says, because the hall did not have enough light, but the angle, she says, was good. It showed the hall, people at the background, to portray ongoing activities, children with drugs, giving the story that it could be a hospital or clinic. All right, Chris, what with your visual storyteller eyes, what do you see in this picture, and what would you say to Loretta if she asked you questions about this photo?
Well, first of all, hi Loretta, and thanks for your image. I hope you can hear me.
Pour commencer, bonjour Loretta et merci de cette photo. Si l'on étudie cette...
A few things going on. So we see the kids, and they've just been vaccinated, and in the background there is someone behind a desk, and maybe there's a client sitting next to him, and on the right we see people waiting, or and so there's in fact, and there's someone in the middle of the picture, maybe holding a phone or something, and she's walking to the left out of the picture. So in fact, there's a lot of things going on. When you look at the picture, you want to focus on what's going on. So my first, I'm drawn to the kids, and but not all the kids are with me, because there are two looking to the right, and the other two are looking towards me. So if you take a picture like this, you could wait, and get the attention of the children, so they all look at you. And the lady who is standing behind them, you can maybe ask her maybe to leave the frame, or maybe she can also look at us, because now she's like, she doesn't belong to the scene. So that's a bit of advice I wanted to give to Loretta. And but what I really love about this picture is it's layered. So you have a foreground, you have a background, and that makes it really interesting to look around in this picture. It's like a picture's like a book, you know, you read it. So yeah, that's my bit of advice for her.
Wonderful. And Charlotte, could you tell us more about what Loretta responded to the 4 questions about as together with this photo submission?
Yes, Reda. So Loretta said she had learned, when asked what she learned from sharing photos and seeing the photos of other colleagues, she said she had learned that photos tell a story by themselves without even the photographer saying a word, and that good action photos tell better stories than a standstill photo. She, however, had a question from Chris, and I think Chris has already responded, because she said, what does he think of the photo that she shared? And she's looking forward to sharing pictures of immunization monitoring, interactions with caregivers or community stakeholders on health facility improvement this year.
Great, thank you, Charlotte. And I'd now like to turn to the participants. Let's see if you'd like to also, just as Chris has shared his insights and what he saw in this picture and what he would say to Loretta, if as a health professional, so Chris, of course, is a professional visual storyteller who's dedicated his life to this art. Most of the folks in the room are health professionals who took time out to take pictures in the last 2 years. I'll tell you a bit more about that. Would love to hear from you what you see in the picture. Let me see if we can go to Funmiyalo David, or let me see, Jean-Pierre Okonjo, or Jean-Richard Mutombo, so that you can tell us, or Kwame Georges Conan, who I know has contributed also a photo. If you'd like to tell us, please open your microphone so that we can also hear what your thoughts are when looking at this photo. So let's go to François Désiré and Aimé Ngenda. Ok, Kwame Germain Conan, c'est à vous.
Oui. Moi, c'est François Désiré. Bonjour à tout le monde.
My name is François Désiré, and hi to all. What I see on this picture is probably a mobile clinic here with a consultation in ambulatory mode, because I can see that there are some kids who have finished their consultation, and they already have the medicines. The 4 kids that you have at the front of the picture, the 2 girls and the 2 boys, and there's a lady who's has a phone in her hand, and with her gloves means that she's probably is a agent working for this mobile clinic. And you can see 2 tables for consultation. I can see a lady with a consultant, and you have the people maybe who are just waiting for their turn and who are still sitting on their chair. So as the colleague said, there are many things happening in this room. And this is most likely a mobile clinic moment, I think.
Thank you, François Désiré. Now, I see one question that jumps out at me that I believe is a really important one. I thought, Chris, we didn't discuss it before, but and that is the question from Professor Becky Tagbo. Is Loretta expected to get permission from all these people in order to be respectful and just really recognize the dignity of the many, many different people in the room? What would be, so this picture was submitted. We asked her to confirm that she had in fact secured the consent and permission. Can you tell us what the reality of that is when you work as a photographer, and what you would say, what advice, like what's the critical thing that you would say to health workers who are taking pictures of their daily work to make sure that people they're taking pictures of have agreed to be in those pictures? I realize it's a complex question, but what can you say quickly that could help practitioners?
Yeah, it depends a little bit from my experience for which organization I work. Everybody's got his own guidelines, but my guideline is when you photograph a group of people, So like, let's say like more than 5, like in the picture of Loretta, where you see many more people. It's like a general consent you ask from people. It's like an oral consent. You ask like if people enter the room, do you mind if there's pictures being taken, and so on and so forth. So it's more general. If you focus on one person or 2 or 3, you ask individual consents. Because later when a picture is published, the impact of an individual might be bigger than for a whole group of people. So that's how I would go about it.
Okay, thank you. Thank you very much indeed, Chris. Now, we're discussing this picture that was submitted by Loretta Aouk-Peme. Unfortunately, she's not in the room. I believe, Charlotte, correct me if she's arrived. If she's on the live stream, she hasn't sent a message yet. But be that as it may, we know that she'll be watching, and she's received some advice from both Chris as a professional photographer and some comments from her colleagues. We'd like to go to Aimé and Genda. Aimé, est-ce que vous êtes là? Est-ce que vous pouvez vous présenter?
Ok, merci beaucoup. Merci, chers collègues, pour cette invitation. Et merci à Loretta pour cette belle photo. Je vais d'abord commencer par la dernière préoccupation pour partager l'expérience ici en RDC sur la signature de droit à l'image.
Darcy, with regard to consent for the image right, you need to be careful with regard to the image rate, because if I look at what happened to me, we had a problem here in our vaccination program when we took a picture of the child of a colleague that we printed on banners, but there's a group of imposters that went and complained saying it was their child because he was looking like theirs. So we showed the letter of consent from the parents and the picture of the child when we took the picture, because it was actually an old picture. So the consent is usually verbal. Most of the time in rural settings, it's not a problem, but in urban settings, based on our experience, you need to ask for a written consent that you should keep, because you get some people that would take advantage of it and think that when you take pictures of their children, they think you make money out of this without paying them any fees. With regard to the picture that was shown from Loretta, we would like to congratulate her for that picture. The first thing I see is that we can see that there are several different departments, services available at the same time. But what I would say is that when you take picture of children, you can show also the responsibility of the parents in taking the medicine. So we would have like the parents to be next to the children when the picture was taken, and also to ask maybe to be placed in the angle where you can see also the communication elements, the support element, such as some banners or posters or the name of the structure of the center. So the contextualization for the picture would be better to show that it's a health center, for example. And also if there are teams working in the background, and maybe also, as I said, having the parents with the children to show the responsibility of the parents, because children cannot take medicine on their own. But we think the picture is very, very good, much appreciated. And I learn a lot from professionals that give their advice on the different angles, and always to ask consent of the people who are on the pictures and so on. This is a very interesting workshop, and thank you very much for this.
Thank you very much indeed. Now, we're going to tell you now with Charlotte how we came to, at the Geneva Learning Foundation, invite Chris deBode, who's dedicated his life to visual storytelling, to meet the health professionals who are doing life-saving work on immunization, who are sharing observations on climate and health as well, and how we came to this. So in 2022, with Charlotte, we launched a call for a World Immunization Week celebration. This was part of the launch of the movement for Immunization Agenda 2030. 6,185 health professionals joined on this movement on the 7th of March 2022. By June, when after having this World Immunization Week celebration, there was over 10,000, and there are now tens of thousands of people participating. This was the 2023 event. And as you can see, we had a second. And each time, what did we do? We sent out a call to action saying, would you like to share a photo of your daily work, the work that you do every day? You know the hashtag vaccines work. Well, here the point was to show that it takes people to make vaccines work. And indeed, we actually published 2 volumes, 2 collections about telling your own stories. You can see the 2022 edition here and the 2023 edition on this side in English and in French. If you have not seen these yet, I strongly encourage you, I highly encourage you to go ahead and download them. I'm hoping Charlotte has already posted the links to do so. So that is on immunization. How did we come to climate change and health? Well, on the 28th of July 2023, we again launched a call to action, and within 2 weeks, over 4,700 health professionals has signed up for this special event. From community to planet, health professionals on the front lines of climate change. We ask you to share your experience and to tell us, share your observations, not with the Geneva Learning Foundation, with each other, in order to help each other make sense of what is happening in these different contexts. And so what we had was 1,260 observations that you shared, and that we then, in line with our commitment to give back to the community whose knowledge it is and whose experiences they are, we issued a series actually of reports on the front line of climate change and health that are now resources for health professionals everywhere who want to understand what is happening in other countries, in other communities. Now, as we're going forward to Teach to Reach 10, which will be on the 20th and 21st of June, we've decided to really highlight the front line of climate change and health, because you told us that is where you are. You live, you work on that front line, you're seeing the consequences of climate on health. And when it came to speaking with Chris about this workshop, he immediately said, can we explore climate change and health? Chris, can you tell us why, after 2 years of exploring, documenting the daily work of immunization, why it got you so excited, the idea to ask and sort of engage health workers on the front line of climate change and health to begin taking pictures of what's actually happening on that front line?
Yeah, that's thanks for this question. So over the last two years, let's say, we received so many pictures about your work and what you do. And my feeling was, like, by asking you a new question, a different angle on what you work on, that we can go a little bit deeper in what you actually do. So find a new layer of what you see and what you encounter in your work. And climate change and health is such an important topic. And since you are on the front line everywhere in the world experiencing the effects of climate change and health, it's super interesting to create a large collection of these images to show the world and also show each other within the community. So that's why we wanted to go and push you a little bit to reach that new different layer in what you actually encounter.
Wonderful. Thank you, Chris. So now we're going to go into Chris's presentation, which he's prepared for you as health professionals working on the front line of climate and health, making vaccines work through your work. So the title of this is Photographie créative et narrative, libérer le pouvoir des récits visuels, unleashing the power of visual narratives. We're going to do this the old-fashioned way, Chris, and you're going to have to prompt me when you want the next slide. I believe this is your first one.
Yeah, thanks for having me, Reda, and thanks for the introduction, and thank you all being connected now through this platform to to listen to me, and hopefully I can teach you a little bit more about photography and how to go about it in your daily work. So shortly about me, I've been photographing all over the world for many years, and I realized that for me, like a photographer being invited and flying all over the place, it's time to set a step back and let you do the work because you are on the forefront, and I really believe in your power, and that's why we're all together here, and hopefully you'll take something away from my presentation. So when we look at this first picture, I shot this picture in northern Uganda, and it was part of a book I was working on the dreams of children. And the reason why I show you this picture is it's not only because it's very dear to me, but it's also there's also a funny side to it, because photography, as you might know, is really subjective. It's not the reality, it's the reality you create as a photographer. It's you who decides when to push the button, and it's you who decides what you want to show in your image. So when we look at this image and we go to the next slide, we go to the reality. And this was the reality. So these are all school kids, and this one boy you just saw in the first slide was my subject, but I really had to intervene and ask people to clear the scene, and I really had to act as a director and try to create a scene in which this one individual could star, and that's one of the most important things of being a photographer. You are the director. It's you who decides and what you show to the audience. So go to the next slide. So what is a very important thing is that we are all human beings, and photography is such it's you show the relationship with you and the people around you, and that's a very sensitive thing, because sometimes photographers, and especially professional photographers, they think the image is more important than the people in the image. So I would really encourage you, to be vulnerable, and to really relate and do respectfully with the people around you. And one of the things that really helps is that the moment that you get out your phone or your camera, that you make yourself known to other people, that you show your intentions, that you're going to make images. And that's already one step that people can relate to you. And in that sense, you create space for yourself to be free and to make contact with other people and start taking your pictures. And then you can be directive in how you create the scene, is like what I told you before. So you take your time and you relax. And a very good thing, and especially when you as health workers, you return to a scene over and over again. You go to the same places or you go to similar places. So you can photograph scenes over and over again, and you can try to find a little bit more depth in your story. And what I mean with that, finding depth in your story, is that you focus on your image and make your photo a bit more clean. Do you remember when I gave my comments on Loretta's photo from Nigeria, that I said, like, if you take a little bit more time and you get the attention of people and people look at you, then your picture becomes more serene in a way. And that's one of the most important things. Take your time, make yourself known, and be sensitive, be vulnerable for the people around you. Next slide, please. And by the way, if you have any questions on the things I say, raise your hand and ask, feel free. So this is one of my favorite images. It's a girl from living in South
Chris,
Africa.
You asked, and Emmanuel Musa immediately, his hand shot up. Emmanuel is a longtime TGLF scholar and immunization leader in Nigeria. Emmanuel, what's on your mind? What would you like to interject here? And please do introduce yourself.
Good morning, colleagues. My name is Emmanuel Musa from Kaduna, Nigeria. And just like what Reda said, I've been part of the movement for almost 5-6 years ago. Now, my question is to Chris. No, professionally, we've been asked to take pictures, action pictures, not to have a kind of or arrange or organized setting. So in Loretta's case, I think probably we're following through our workforce or advices of where we work. Because normally we look at pictures that are actionable, that probably funders can see, or probably supervisors can see what's happening in the field, instead of organizing a group picture. Okay, you set as if we're in a studio. So action pictures is mostly when you see us sending pictures that are actionable, that can be able to explain what we do in the frontline as frontline workers, or what we do along in the field. So in that case, looking at your advices, that probably Loretta's, those two kids that two were looking directly at you, and two were looking at the other, which means, yes, so this is the picture. Two are watching directly to probably the photographer, and then two are watching somewhere. Probably it's a scene that probably has a distraction. And look at it, it's actually the woman with the phone, probably she could be a staff nurse or a client that has visited the health facility. So you could see that, for me, I look at it, this is action picture. And I'm sure the picture is just really depicting that you could see the setting at the other end of it with two plastic chairs, which means it is a health facility setting that is really showing you that this is actually, that is where the picture is. You need not to go to probably, there could be posters. Yes, there could be posters that shows it's a health facility. Because for us, when you go for supervision, you need to have a report on an action. You need not to be told that this is where it is happening, because people can go somewhere, rearrange people and snap picture and send, and believing that it is actually what is happening in the field, not knowing that it is not. But actionable pictures like this will be able to explain that it is captured in a health facility and is explaining the purpose and probably the aim of why it is. Thank you, Oreda, for giving me the opportunity, and I'm out. Chris, if you have any other thing, please help me just to do one or two explanation of it. Thank you.
Yeah, thanks, Emmanuel, for your question. I understand your question. Action pictures and stage pictures. These are two different ways of going about to depict a situation. And for a good picture, a picture which makes impact, you have to make a choice between these two, stage or action. And Loretta's picture is somewhere in between. It's staged in a way because people are looking at her, and it's clear that the kids are in the foreground, and it's action because kids are not looking and somebody's standing in the background walking away and stuff. If you make an action shot, it's essential that you make more than one picture to choose from. Sometimes if you're a professional photographer makes a lot of pictures, and afterwards he picks the best one. Amateur photographers, most of the time, take only 1 or 2 shots and that's it. You know, and that's for obvious reasons, because they're not really dedicated to the job of being a photographer who's looking for the best picture. But my role now here is to tell you, like, there is these 2 different things. If you are interested in depicting a situation and photograph a scene in an action scene, make more pictures so that then you can decide which picture you take. For example, maybe it's the best picture when none of the kids are looking at you, and that the girl who is standing in the backdrop has left the picture, you know, and so you can focus more on these kids. Or make the decision, let all the kids look at you and wait a little bit until your scene you photograph is more clean, that there is less noise in your picture. Do you understand, Emmanuel, what I mean to say with this?
Emmanuel has his microphone turned off. Emmanuel, if you could respond in the chat.
Thanks, Chris. Thanks for that insight. Thanks for the clarification.
All right, wonderful. Now,
and I think Reda, probably what we should be doing, instead of posting, maybe when next we shouldn't be giving maybe 1 picture. Probably the advice is to probably we have 1 or 2 pictures that is picked, and then we now upload, and then you now make a choice on the one that you need to.
Interesting. Yep. All right, thank you, Emmanuel. Just a reminder of the rules for fairness on speaking in the Geneva Learning Foundation events. So our next speaker should be a woman who is not from Nigeria. Now, let's go back to Chris. So please do raise your hands if you'd like to speak, if you feel you have something important to ask or to comment. Chris, back to you. And we'll have quite a bit of time for questions really after Chris's presentation. So we have this really remarkable picture of a young girl with a pink flower, and there are pink flowers on her dress. And yeah, tell us what's happening here, and what would you like to share with the group about it?
Yeah, thanks, Reda. So this girl, like you say, is holding a flower. It's a cosmos flower. They are growing in South Africa, maybe all over the world. You find cosmos flowers, and what a picture makes a nice and beautiful and impactful picture. If there's some alliteration in the picture, for example, this flower, and really good that you, Reda, that you saw there's also pictures on her dress. It's something I think about. You know, I think about when I photograph, I think about color. I think about things I see which are matching. You know, and these things, these little details, can make a real big difference in if a picture is good or if a picture is excellent. So these are the things I look for. And like I said before, you know, I'm not afraid. You know, if you want to make a portrait of someone, if you want to tell someone's story, and especially, you know, when we look at the question we ask you, like, what's the impact of climate change and health? Sometimes it's a person, you know, who could tell that story perfectly, because the situation, you know, like someone mentioned before, the floods, you know, which you would like to show. Sometimes the moment that you want to explain what is going on, it's a person, it's a personal story you want to tell from someone. And with a personal story, sometimes it's a portrait which belongs to that. So that's why I wanted to show you this photograph, where I decided to take this girl outside and show her in all her beauty and tell her story. So we go to the next slide, please. So when you set out to take a picture, you have to think first about what you want to show, what you want to tell. And that's where we all start. Like, what is the story someone wants to tell, and which scene belongs to that story. And you can think about that. And that it does not only go for a portrait, what I just showed, but also if we get back to Loretta's picture, and we just take that as an example, it's a scene. You want to show what is going on. You want to show your work. And then you have to think about what is the best place to take a picture of to show what I'm actually doing, or what is really important in what I want to share in my picture. So it starts with that. So you have to create that framework, like I call it. And if you create a framework, it becomes easier for you to take your image, because you already decided for yourself, like, I want to take this image with a certain content, and then you focus for yourself on that scene. So if you, for example, want us to make a story about a person in a clinic, you don't take him outside in a busy shopping center, because that distracts everybody from what you want to tell. If you want to do a story on cats, you don't make a story on telephone booths, because it's about cats. And it sounds really stupid, but it makes yourself, you make it easier for yourself if you know what you are going to photograph. Second or third, what is also very, very important, if you want to tell a story, it's really good to find a story which is close to your heart. So you shoot a picture of something you think is really important, or maybe it's something which touches you, what is close to you. And that makes it also easier to start and make pictures, because it comes from your heart, and that's really vital. If something is not really, doesn't really interest you or stuff, it becomes more difficult. You make it more complicated for yourself, to make this beautiful image. And why I'm telling you this is that I want to encourage you to take more pictures, and not only this only one picture you want to submit, about climate change and health, but also if you want to continue photographing and you want to use photography maybe for your personal interests, or to take pictures of your family, or about a certain topic you're interested in. These are things which really matter, and these things will push you to take your photography a step further. And what is really interesting about photography is that the photograph you make is not only telling us what you see, but it's also telling us who you are as a person. It's like, it's your interest, it's your frame you show us. And that makes photography very interesting, because, we're all individuals, we all have our own personality. And if I ask 10 of you to make a picture of a similar situation, all these pictures will be totally different from each other, because the photograph is telling a lot about yourself and your ways and your decisions you make to make that picture and show it to the world. Next slide. Any questions in the meantime?
Yes, we have Elise Joycena, who's had a hand up for a while. Elise, before we dive into Chris's next picture, would you like to speak to us? Si vous souhaitez nous parler, c'est maintenant qu'il faut activer votre micro. Now is the time to turn on your microphone, Elise. You should be receiving, vous recevez en principe. Okay. No, nothing from Elise. Please go ahead, Chris.
Thanks, Reda. So Elise, when you think of a new question, please let us know. So in fact, this image you see now reflects on what I just told you before. These two men I photographed in Nigeria, and I know at this moment there's many of you from Nigeria joining us here. It's a photograph I took in Gulu, and it was related to the problems in the northeast, and with the issue with Boko Haram and all these things. And there were a lot of refugees coming to Gulu. And the reason I wanted to photograph this issue is that I was really impressed about how Nigerians were able to host all these refugees. And I wanted to photograph this story because I wanted it to be a bit of a lesson for us in the Western world, where we also deal with the influx of refugees, and we're not really hospitable in a way. We try, but if you look at Nigeria, and it was like more than 1 million people were invited by local communities, and people showed their love, for the people who had to flee and everything. And I wanted to show that. And in this image, you see a man, the man in the center of the image, who hosted a whole family, and an extended family of maybe like 20 people or so in his house. And the man sitting to the left, he has got Parkinson's disease, and you see the hand which is on his knee, shows the love and the care, and that makes this for me a very warm image. It shows the relationship between these two men, and it shows care, and that is why this is a really important image for me. And I think in your practice as health workers, you come across a lot of these stories, that people are together and visiting a clinic or whatever, and taking care of each other, people helping each other. So, and if you carefully look at this picture, you see that there is no noise in this picture. It's only these two men, and there is no other things distracting in the image, which take away the attention to what I mean to tell with this picture, and that is the care they have for each other. Next slide, please.
Chris, we have a question from Malamine Sané, who we heard at the beginning of this event, and he says, so are there different sort of positions, and I assume he means for the person taking the pictures, depending on the target, he says, so the subject. If yes, I'd like Chris to tell us more about that so that we can improve our photos in the future. Is there a quick response on that question of where you put yourself where you place yourself as a photographer? Where were you here in this picture, for example, and what would be your guidance or your advice to Malamine?
So it sounds funny, this one, but it's one of the most important tools we have as a photographer, and that's our legs. That's the feet we stand on. We can walk around, we can lower ourselves, or we can stand up. And all these movements we make as photographer change in a way what you see in the actual picture. If I'm low as a photographer, or on the same height as something I photograph, you relate directly with someone. If I stand tall and I look down on people, these people in the picture, they maybe lose a little bit of their dignity. And if I'm sitting low and I put my camera a little bit up, they've got more pride. There's maybe they become stronger. It's really like looking up to people or looking down to people. That's really important. And just to, as professional photographers, we have lenses on our cameras and zoom lenses. We can come closer or further away, but essentially, it is us. It's our body, who moves around and we can make choices how to frame the picture and how to make the picture clean. So you make sure there's nothing in your picture which distracts you from the actual scene. Yeah.
Thanks,
so
Chris.
Hopefully answers your question.
And I mean, let us know if that satisfies your thirst for Chris's experience on this question of where you put yourself as a photographer. Now, Chris, your next slide is called "The Way to the Image."
Yeah. In fact, we just talked about that. It's very important that people know your intentions so they can relax. From my experience, if I walk into a village, the first thing which happens is that people surround me because I'm an outsider. People don't know me. And the moment that I explain to people like what I'm coming to do, who I am, and I get my camera out, people start to ask for pictures. Take my picture, whatever. And that happens only in the first 10 minutes. After they're familiar with you, they go on with their lives. And from my experience, they don't really care. And that's the moment where you can become more intimate and you can start doing your job as a photographer because people know what you do and they just continue with their daily lives. They lose their first interest. And then the next step is, if you see something which you find interesting, you make contact. You go to someone, you start talking, you start asking questions, and you show your interest to someone, and people like to tell their story. They like to be seen. They like to be heard. It's a bit of an interview you do with people. So if you show your care, then you find the key, to let that door to someone be opened. I sometimes say that the doorbell, it's more important than the button on your camera which you push to take a picture, because if you ring the doorbell, the door opens, and that's the start of the contact you make with someone. And if you create that situation, then you can go, you can take it a step further, and your images are not candid anymore, but they are involved. And I have to say, there's a lot of psychology in photography. There's a lot of things, psychology in you being the photographer, because what happens if you are taking a picture, sometimes you have the feeling like I'm intruding somewhere. I am intervening in a situation. You almost feel that you take something from someone, and that sentiment, that psychological aspect, that prevents you from being open and free to take your images. And if you make yourself known, it's not like you're stealing a moment from someone. You level, you are exchanging, and that's really, really important to find the peace in yourself to make an image of someone or make an image of a situation.
Chris,
does it make sense?
There's a message from Ntombi Gumede who says the way you position yourself is very important. Look down or looking up on people and giving them their dignity. What would you say to that?
Well, it's true. It's the way it works. And I think you and that's how I start. That's how we started this workshop. On the first slide, I said like be vulnerable, you know, and have respect for the people you meet. It's it's like you take a picture, you know, of someone. You take a picture. It's almost like when you say like I take a picture of someone, that you take something away from someone. But that's not how it is, you know. It's more like you level with someone, and leveling with someone also means that your camera levels with their position in the photograph.
One more comment from Malik Ndome, so this one's in French. Et une photo est parlante quand les images décrivent des actions en vrai. So is a photo more meaningful, more powerful when the images it describes show real actions? And I guess that goes back to that first comment from Emmanuel Moussa. Why do we have this obsession with making sure that things are so real when it sounds like in the work that you do, you say you direct individuals, you create the image, and yet we want this to be perfectly authentic. How do you reconcile those two as a photographer?
Yeah, thanks for this question. It's a very important question, I think. Like I said, a picture is always subjective. It's your position as a photographer who decides which picture you take and what you want to tell with the image. So if you say that my images are staged most of the time, in a way that's true. When I take portraits of people, I stage and I always stage. Also, I stage also when I take an action picture of someone in somebody's private life. I also stage when I come into a situation in a clinic and I make pictures. I first made sure that people knew who I was, and I introduced myself so people know that I'm there. That's also a way of staging. But I understand perfectly what you mean to ask.
There's even another one. Professor Becky Tagbo says, she wants to know, did you edit the background in your photo? What is that saying? How do you respond as a photographer? Because questions so far seem to be about technical issues. Where do you position yourself? Or is it actually, to what extent have you sort of doctored up the picture? And you're telling us that the way to the image is to come close, to make contact, to make it more personal, make it about something you care about. There seems to be a gap between what participants are concerned with and what your experience as a photographer, as a visual storyteller, actually tells you is the most important stuff that you're sharing here.
Well, I mean, if you, I'm talking to you, community health workers or health workers, and you work in an environment where people come to a clinic or people are being helped by someone else. So you have to be really careful about what you photograph and how you photograph. And we already talked about consent and all these things. But also, if you make yourself known and people know what you come to do, then you can start making action shots, because you create space for yourself, and you can put people at ease because they know who you are and what you come to do. And that's what I try to focus on here, is that you have to create space for yourself as a photographer, and you have to bear in mind that the people you photograph know who you are and what you come to do, because that is respectful, and I think very important, especially in the field of work where you work in and what you take pictures of. So that's maybe that is filling the gap we are talking about right now.
All right. Okay. Wonderful. I suggest we move on so you can complete sharing the thoughts that you had prepared for today. Then leave some time for questions. I just want to draw your attention to Ntombi Gumede's message, who says, "Chris, you ooze passion with what you do. You make it very exciting. Thanks a lot."
Wow. Thanks. Yeah. So Reda, what I want maybe to leave a little bit of time for questions. Just run through my last slides, so what I'm going to tell you is a little bit more about light. The light in pictures is very, very important, and in the picture you see right now, it's obvious that light is important. You can use lights. You can, just go to the next. We forget about this slide, Reda. We just move on because I think we already.
I don't mean to rush you at all, Chris. I think this is very much being appreciated by participants and stirring their thinking and my thinking as well as together with our team.
Sure.
Yeah.
But yeah, if we talk, I
no
think
light, no image. Yeah. Okay.
Exactly. That's the one I'm looking for. Yeah. Light is important. Light makes an image. I'm from Holland, by the way. I'm Dutch, and maybe you're familiar with the Dutch painters like Rembrandt, who had this very, very unique light in his paintings. And that was for a reason, because the use of light tells you a lot about a certain mood, a feeling you have. It shows beauty. Light focuses on things you like to highlight in an image. So when you look at a situation, for example, in a clinic, there is daylight coming in through a door or through windows. You can use that light, so what you see most with amateur photography is that people point their camera at a certain situation and they shoot the situation as such. But sometimes it lacks a little bit of excitement because the light is very flat in an image. And what I mean with that is that if the light is all coming from the same direction, from the front, like when you look at me now, on the screen right now, the light is coming from the window right in front of me. But if you Reda, if you show that slides here, this one. This is a boy standing in a doorway, and his shadow is being reflected on the wall. And what is very, very difficult about our job as a photographer is that we normally work during day hours, because that's when the action is happening most of the time. That's when the clinics are open and everything, and in some cases there's a lot of sunlight. The sunlight is hammering down on the scenes, especially when you work outside, and then it becomes really difficult to make exciting pictures because the light is just making everything almost like dead, with very harsh shadows, and that you don't see people's faces. So you can play with that. You can play with the lights, and that makes it photography. Light makes your image. So I would advise you to look for the light. Where is the light coming from? And position you where you can play with the lights, and that makes it really, really, really fun to walk around with a camera or with your phone. If you look for these exciting dark shadow movements and stuff, and also in a situation, when For example, the picture I just showed you of the boy standing in the doorway, or the previous picture where you saw the boy, exactly this one, with the cow. Your picture comes alive, and all of a sudden people will say, "What a fantastic picture," because the light is doing its work. So, as a tip, an advice for you, if you want to make a portrait of someone, a portrait from your colleague, or maybe from someone who is just being consulted or whatever, search for the light. Take someone with you and move someone towards the window where you can play with that light, and that will instantly make you a better photographer, and people will applaud you for the results.
Thank you very much indeed, Chris. And in fact, we have Okechi Nzedibe who says light focuses on things you'd like to highlight. That's one of the that's a comment from the participants who are health professionals, not photographers by profession, but who in the past 2 years, as we've said, have shared over 2,000 photos of their daily work. And I'd like to also, in the last segment, so we're at the 13-minute mark, so we have just 17 minutes left in this in this workshop. To discuss some ideas how, for health professionals who've responded to the call for climate and health, how they can think of and approach what pictures they're going to take. We heard a very moving testimonial from Tafurola Mutange, who spoke about the floods that she's been an eyewitness to. And so what do you show? How do you show that in a dignified way? I hope we can get to that and hear your thoughts on these complex issues in the final part of this workshop. But I know you have one more slide about polishing your narrative. And for some reason, this brings up the idea of like polishing a car, making it really, really nice and clean. We'd love to hear you on this.
Yeah, just very briefly. When you look at a movie, when you go to the cinema, this whole movie, all these different scenes you see in a movie are brought together by color grading, we call it. So the color grading adds to the atmosphere of the film. If you shoot a film about wildlife in Africa, the colors will be very warm. If you go and you see a film about people surviving on the North Pole, the colors will be very blue. And it gives your editing of your picture gives you a feeling. There are lots of apps out there on the internet which you can use. The one I use a lot is called Snapseed. It's a Google app. I'm not paid by Google, by the way. It's just something I like. There are many more. With these apps, you can alter the color a little bit, or you can, literally make things a bit brighter. It's like what you see here now on this slide. You see a picture of my dog. My dog who sadly passed away 2 weeks ago. But I honor my dog in showing you this last slide. So the picture on the left was how I shot the picture with my phone. This is a picture shot with my phone, and the one to the right is when I did my color grading and my polishing, so to say. And you see in the picture on the right, it gets much more depth. It gets more contrast. It makes it more beautiful, more powerful. And by playing around with these apps, you can add a lot of spice to your picture. I have to warn you though, don't push it. Don't push it too much, because if you do it too much, your picture becomes a bit fake, a bit plastic, and that's not really what you want, because if you're showing real life, if you show action, or you show a portrait of someone, you don't want it to be far away from reality. But by altering a little bit, a little bit more contrast or a little bit more warmth to it, or you make things a bit lighter, a bit darker, you can focus or draw the attention of the viewer to certain things you want to highlight in your picture. So what I just told you about the use of light in your picture, and the comment that somebody gave, like using light to highlight things or image, these are things you can do with these apps you find on the internet. So to give a little bit more spice to your image. So basically, that is what I wanted to share with you. I'd like to end with this portrait of Bashira. She is a Syrian refugee living in Jordan. This portrait I took from her was without filter, without anything. The eyes are as bright as they are in real life. And I just wanted to show you this picture because of its simplicity. I just put her in front of the window where the light is coming in on her face, and making her eyes radiate and shine and look at you as a viewer. And this is just done with, normal daylight and a very clean backdrop. I think it was a curtain hanging in the room. This is the power of images. This is what you can do as a photographer. You can do this. And I'm really looking forward to what you are going to show, and I truly hope that you've learned something from this workshop. And I know you still have a lot of questions. We're going to answer them in the next couple of minutes. But let me thank you for your attention and for sharing my knowledge with you. All right, there we go.
Wonderful, thank you, Chris. Chris deBode. For this first time we're doing anything like this at the Geneva Learning Foundation, a workshop, a dialogue on visual storytelling for health between Chris and health professionals who participated, who work in immunization and who've shown concern for the impacts of climate change on health. Now Chris comes, in fact, the Q&A, we've had some great back and forth already, some great questions and comments. Before this event, we asked for your questions, and you can see a kind of list here. All together at once. There are many questions, and then I want to especially acknowledge those of you who took the time to answer the 4 questions we asked you. So that's Dr. Faiza Rabbani. We're not going to have time, unfortunately, to go through, and we're hoping we'd get some time to discuss some of these pictures, but I'll just scan, basically quickly flip through them. They're available. We'll share, of course, the full slide deck. We have Etaba Maurice Cyril from Cameroon. We have Yusuf Sawadogo, who's an international consultant for WHO. Dr. Kwabika Chikala Jeff from the Democratic Republic of Congo. Gladys Abena Osua from Ghana. Just want to honor and recognize all of you who took the time to answer these questions. Of course, we looked at Loretta's photo in the opening. Tumu Ramie Kenneth from Uganda, and I believe these stop on Thursday evening. That was the closest we could, and really want to thank Charlotte for putting these together as late as Thursday. Nicolas Kashama Saida, Conan Kwame Germain, Zongo Inufu, Peter Mutai, Bruno Lenkodahi, Kingsley Kofi Ninyere, Damu Galadima Dagona, Anton Benle Gumede, Jean-Richard Mutombo from the DRC, Symphorian Endugasio, Ali Usman Yahaya, Ilaka Naka Mukwi Kila, Jules Fuseine Dembele, Mukhtar Suleiman, Tamba Daniel Ten Kiano. Now, of the many questions, so do raise your hand. We'll do one more try for Elise. Elise, you get a second chance to ask your question or make a comment. But what I thought would be most helpful, Chris, I'm just looking at the questions. Yes, of course, Tena, you will have the full presentation. Is really about climate change and health. We heard Tafarodar say that what she would like to talk about and show is the floods that she's been an eyewitness to. And so the most obvious thing that comes to mind, very literally, me, I'm not a photographer, I'm not a visual storyteller. So I would say, well, I'll try to take a picture of the flood or the flood's consequences. How would you, Chris, think about it as a visual storyteller? How can you take a step back, and what would you say to Tafarodar, knowing that this is very personal, but then probably quite painful to have seen a community affected by these floods that are growing in frequency, probably due to the effects of climate change, and as a health worker having to be on the receiving end of people whose health is damaged by the floods, in some cases losing their lives. What would you, if you could sit down with Tafarodar, what we can't do here, but what we'd like to is sit down, have coffee together, share a meal together with Tafarodar. What would you tell her? What would you ask her? What would be the questions you would ask her to consider in order to figure out what she can actually take pictures of to powerfully tell the story of the floods that are being driven by climate change and that are impacting the health of the community that she serves?
Wow. I would love to have a meal with her and talk about this, and maybe we should. What is very, very important with these really big topics is that you make it small. You make it, you try to make it personal, and you try to give it a face or a name, because if a big issue like floods or the impact of climate change and the consequences like hunger, malnourishment, disease and stuff, it becomes when it becomes personal and it becomes someone's personal story, people start to read, people start to become more interested because it's easier to relate to. So you make the topic smaller, and by making it smaller, you focus more on something. You pick something from this really big topic, like a flood, which is very generic and huge, with its impact and everything. But by focusing and making it smaller, by telling the story from a personal perspective, you make it more interesting. And then I would say to her, like, maybe, she was telling about the little girl which was taken away by the flood, but when the flood reached her house, go and talk to the family, go talk to them, and maybe go to the room where the girl was staying, and show us where she was sleeping and where she was at that time, and then you create impact by just showing the river only without any context. Then it's too generic, and people don't really maybe understand what it's about. So make it personal, make it small. That is the most important thing. A colleague of mine, when I just started out as a photographer, told me, make it small. If you want to photograph for example, the conflict now in Palestine, for example, go to one family, and this family will tell you all the consequence and all the impact the problem has for them, and they will show you all the different aspects of that situation. So make it small.
So Chris, thank you. Our dialogue started where you said, well, you spent decades flying around the world, spending a few days with people in local communities, figuring out how to use that time, very short periods of time, to understand what was happening and to show it, then to tell the story visually in a dignified, respectful way. And the first thing you said was, actually, health professionals who are there every day may not be professional, may lack the professional photography skills, but actually have a huge advantage over you and many others. Can you tell us what that is? And can you tell us what can we do with that? What do you think that the health professionals who are participating in this workshop can do with this advantage? Once you tell us what it is.
Well, it's all about time. You know, if you fly me in for a couple of days, I always miss the action, so to speak. And I have to use metaphors to explain what happened before and what is not happening at the moment when I am there, actually. You know, that happens a lot. And that's maybe the reason why I became a creative storyteller, because I always had to find solutions for something which was not happening at that very moment. So to find different ways to explain. But you guys and ladies, you are there on the spot. You're there every day. So like what Reda said, you have a large advantage on us professional photographers who have to go there, and that takes a lot of valuable time. So use that. If there's something happening, if you hear something which is really important, which you want to show, what you want to take pictures of, go there and invest a little bit of time, because you are on the front line, and that's so very, very important, and that's why your work is so important. And if you use the power of photography during your precious hours and to show us what is going on, that'll be a large advantage to what I, as a professional slow photographer, can contribute. So I would love to ask you to use that time you have and use that advantage you have on me, and I'm looking forward to what you come up with. I'm really excited. I was really excited about this workshop. I'd like to thank you again, and let them come in, these pictures, and show us what you've learned. So yeah, I'm excited. I'm waiting.
Wonderful. Thank you very much indeed, Chris, deBode, and the Geneva Learning Foundation scholars from all over the world. 553 health professionals were registered for this workshop, live streamed across YouTube, Twitter, X, Facebook, LinkedIn, and I think there are a few other platforms as well. Thank you so much for joining us wherever you were today. Again, telling your own stories, telling the stories of the communities you serve as health workers. That's what this is about. You can find from 2022 and 2023 2 volumes. It takes people to make vaccines work, and the many faces of immunization in English and in French. You can also find on climate change. So we're launching the call this week for photos for ahead of World Immunization Week, but also inviting health professionals who can see and feel what may be invisible to some, but if it's visible to you, what are the impacts of climate change and health? With Chris, he's actually encouraged us to really share this call. And of course, you choose if you want to respond or not, if you have time for this or not. But if you do, we believe that you're in a unique position to help global partners, others who are wondering, what are these effects? What do they look like? And for whom they may be invisible, they're visible to you. Maybe it would benefit us all for you to take the time to show us. I also want to share the Women Inspiring Women Connection collection of stories and images. If Charlotte hasn't already shared the links to all these publications, we'll do so in the follow-up email. Des Femmes pour la Santé, Women Inspiring Women. And of course, in the next few months, everything is leading up to Teach to Reach 10 on the front line of climate change and health. And this will be what we hope will be a massive event. Last one on the 13th of October 2023. 17,662 health professionals from over, I believe it was 80 countries were registered, participated, contributed in various ways. 1,876 insights, experiences shared. And you can find all of that also on the Geneva Learning Foundation website. Thank you. Once again, I'm just going to show what your last chance to share some of the some of your reactions, comments before we close this session. So we hope you will. All right. There's still nobody is leaving the room. So, all right. Thank you, François Désiré, who says, I'm going to share pictures of mobile clinics that integrate immunization and nutrition. So François Désiré, Chris, has given some thought to what he's going to show in his pictures. Alassane Abdul Rahman just says, thank you so much, Reda and Charlotte. Great job done, Chris. Indeed. Gentil Mbelo says, thank you very much. Last chance to get a message out. Again, you'll find the collections of stories it takes people to make vaccine work in the many faces of immunization in English and in French, climate change and health. That's www.learning.foundation/climate. And an invitation this time to share images that tell the stories of what you are an eyewitness to as health workers. This was for International Women's Day, but we're very proud of this women, inspiring women, des femmes pour la santé, of this collection. And of course, Teach Reach 10 on the front line of climate change and health. Thank you very much indeed. We'll see you 20th and 21st of June. And of course, before that, we'll have the World Immunization Week events. Thank you and take care.